What was it?
Did they ever figure out how many she gave out that weren't within the 1A and B?
We'll go ahead and open our regular session of the Yuma County Board of Supervisors. Also sitting as all special taxing districts will be on today, March 1st, 2021, 9 a.m. Board members will attend either in person, by telephone, or remotely via electronic conference. Today we have our chair is absent today. He's excused. We'll go ahead and do call to order and start with the Pledge of Allegiance. Lynn, can you please lead us?
Yes, please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We will go ahead and do call to the public. Call to the public is held for the public benefit to allow individuals to address issues within the board's jurisdictions. Board members may not discuss items that are not specifically identified on the agenda. Therefore, pursuant to Arizona Revised Statute 38-431-.001, action taken as a result of public comment will be limited to directing staff to study the matter, responding to criticism, or scheduling the matter for further discussion and decision at a future date. Anyone who is concerned about COVID-19 and does not want to be put into an open setting can submit an email to the public statement at publiccomment@yumacountyaz.gov. These emails forms of public comment will be accepted until 8 a.m. the morning of the meeting. All public comments will be read aloud during the Yuma County Board of Supervisors. Meeting starts at 9 a.m. Desiree, do we have any?
We do. Today we have two. Let's see. We have one email from Christine Eckerd, and the subject is speed monitoring. She says, we are very familiar with 38th Street speeders, having lived on Glenwood and 38th Street intersection. We left Glenwood 3 years ago, in part because of speeders on 38th Street. We have lived out here in the foothills for 4 years. It's all well and good to mark a new speed limit of 25 miles per hour, but what about the enforcement? It is on a very rare occasion that we notice any sheriff patrolling out here. Will you be monitoring sporadically? Have you considered an article in the Yuma Daily Sun mentioning the new speed limit, and what will the charge be for a violation? Also, I believe I actually went over to your department complaining about how people run traffic lights on Fortuna and there's never anyone around to nab them. I was told then you were understaffed. Please see if you can see fit to email me back.
Thank you for those comments, Christine, and your concern. And we'll go ahead and direct that to...
I have one more from Jose de la Barra.
Okay.
And it is concerning unsightly trash dump. And he's got quite a few photos attached, so I'll forward those to you separately. He says, immediately south of the intersection of Highway 95 and County 19th Street at Gadsden, there is a business which for years has allowed trash, junk, manufactured home shells, burned remains, and numerous other unsightly trash to accumulate. It is on a highway roadway which takes thousands of travelers daily to San Luis, Arizona. I don't know the zoning for that property, but it is an eyesore and appears to be a violation of at least 2 of Yuma County ordinances. Section 304, junk shall not be kept or stored on any property without being confined by a receptacle or container in a rear yard area. Such items considered debris, trash, or clutter shall not constitute a fire or public safety hazard. And then he references a couple other sections and says, there appears to be plenty of room on the fenced portion of the property to contain the junk, which is in public view of everyone traveling on Highway 95. If this is a violation of county ordinances, it should be enforced. If it is not, someone from DDS should speak with the property owners about removing the gross site from public view.
Thank you, Desiree. And again, Christine and Jose de la Vara will go ahead and look into those. Susan, if you can respond back and see what we can do there. Thanks. And before we continue with the I just want to recognize we have the City of Yuma Mayor here today. So just recognizing. Thank you, Mayor. Go ahead, Susan.
Good morning.
Good morning.
Vice Chair and members of the board. On December 1st, 2020, Ian DeGahey, our Deputy County Administrator, achieved the designation of Credentialed Manager through the International City County Management Association. His certificate arrived last week, so I wanted to take time to recognize him in front of the board. The ICMA CM designation is the top international credential specific to the unique and complex work of local government management. Ian has achieved this accomplishment through a significant combination of professional development and local government leadership experience above and beyond the daily demands of leading the organization. As a credentialed manager myself, I understand the value of this designation, and I applaud Ian's efforts to achieve this credential and his commitment to renewing it on an annual basis. Please join me in congratulating Ian.
Thank you very much for the recognition. I sincerely appreciate it, and it's an honor to receive this credential. I look forward to doing the work to maintain the credential in the years to come. Thank you.
Well, congratulations, Ian. Ian, and it's always good to hear and to see that the county employees are still striving to get more experience and more work throughout their career here in the county. So I appreciate that. Thanks. I'll leave the call to anybody else from the public that wishes to address the board. I'll go ahead and leave it open, and we'll move on to presentations and proclamations and appointments. Any appointments from the board? We'll move on to item number 1, presentation of the county line, Yuma 77.
A new emergency response rental assistance program is set to begin. Construction for a smoother drive to Martinez Lake is well underway. And there was another free saliva COVID-19 testing event held at Arizona Western College. These stories and more, this is your County Line. Recently, the Board of Supervisors approved a program aimed at providing financial assistance and housing stability in Yuma County. Yuma County announced their partnership with the Western Arizona Council of Governments to launch a new emergency rental assistance program. The U.S. Treasury provided $6.5 million to Yuma County from the COVID-19 relief package passed in December 2020 by Congress.
We know that a lot of Yuma County families have been struggling during the pandemic, and this rental and utility relief program will help them get through financially during this difficult time.
Funding will be used toward direct payments for rent, rental arrears, utilities, utility arrears, and other expenses relating to housing stability. Eligibility is based on the renter's address and ability to meet certain criteria. County residents will be able to submit applications through WACOG's Emergency Rental Assistance Portal beginning March 8, 2021. For more information, please visit the county's website at yumacountyaz.gov. If you've driven out to Martinez Lake in the past, you may remember driving over many dips before reaching your destination, but that is all being smoothed out. Construction on Martinez Lake Road and Red Cloud Mine Road began in February of 2020. 6.5 miles extending from Rural Metro Fire Station at Fisher's Landing to the Yuma Proving Ground Jump School will help improve Martinez Lake Road. Red Cloud Mine Road will extend improvements to 2.1 miles of road beginning at the intersection of Martinez Lake Road.
We're making the road a little safer. We're paving it, getting rid of a lot of the roller coaster effect that it used to have, giving it a little bit more all-weather access so people that come out here when it rains, they don't get stuck out here. They're able to enjoy it and then get back out easily.
The construction project is set to be complete by June of this year. We'll bring you the latest updates as the project progresses. Although COVID-19 case numbers have seen a recent decline and more vaccines have been distributed, the importance of getting tested is still prevalent. On Saturday, February 27th, the County Health District teamed up with Arizona Western College and Arizona National Guard to provide special saliva testing produced by the biomedical research team at ASU.
We need the people to continue to get tested, ensure they're not COVID positive, so they don't continue to go out and spread that to other people. It's just a continuous effort by all community members to ensure that they are being safe and they don't infect others.
Pre-registered participants arrived on site and were able to provide a saliva sample from their car. These tests help to provide citizens with a simple, easy, and non-invasive way to receive a test, while also helping to provide health officials with a snapshot of the current infection rate in our county. This COVID-19 testing event was free and is used to evaluate as many Yuma County residents as possible. Be sure to follow us on Facebook and Twitter, or you can sign up for all the latest news by visiting our COVID update page at yumacountyaz.gov. Opioid addiction goes beyond the use of illegal drugs. Doctor-prescribed opioids like fentanyl, codeine, oxycodone, and morphine can also become highly addictive. The misuse and addiction to prescription painkillers, heroin, and synthetic opioids have become a national crisis. The faces of those addicted to opioids and dying from them include teenagers, parents, and grandparents from all socioeconomic backgrounds. Opioid abuse warning signs to look for: 1. Mood changes. 2. Changes in eating and sleeping habits. 3. Doctor shopping, getting multiple prescriptions from different doctors. 4. Teens decline in academic performance and change in friends. 5. Pulling away from family members and close friends. And 6. Confusion. Early treatment for opioid addiction saves lives. For further information, please contact the Yuma County Public Health Services District at 317-4550. It's an unfortunate part of how county government works, but occasionally we have to auction off tax lien. With COVID-19 still lingering, this year's tax lien auction looked a little different and was conducted online. After extensive efforts to work with delinquent property owners, the county may have to sell the lien to an investor. The new lien holder then pays the owed taxes. Selling liens on property is the county's last resort, but if we didn't institute these measures, those who do pay would shoulder an even heavier burden. Tax liens are an efficient way of collecting delinquencies for all taxing districts within the county. We'd like to thank you for joining us for this County Line. If you'd like to watch past episodes, log on to yumacountyaz.gov/VOD. And don't forget, you can join us live on Facebook. We'd like to leave you now with a message from Yuma County employee Elia Juarez, telling us why she loves working for Yuma County. We'll see you next time.
My name is Elia Juarez. I am the Teen and Youth Services Librarian for the Yuma County Library District, and I will have worked for the county for 10 years this September. So I'm responsible for programming for ages 0 to 18 at 8 different libraries. I love interacting with the people in the community. I love getting to meet little kids that have just started coming to the library and watching them grow. It gives me a sense of purpose, and it gives me a sense that I'm directly doing something to improve the lives of the people that live in Yuma County.
Welcome back. Moving on to item number 2, presentation by Paul Ward, Executive Director of Yuma YMPO, regarding an update on YMPO's activities. Mr. Ward.
Mr. Chairman, members of the Board of Supervisors, good morning. Thank you for the invitation. This is part of a series of presentations that I'll be giving with all YMPO member agencies, including City of Yuma will be coming up next, and then with the other cities and towns in due course over the next few months. I believe there's a presentation available. YMPO, as you're aware, is the designated metropolitan planning organization for the Yuma County region. It's predominantly for the Yuma urbanized area, although our planning area is the whole of Yuma County from that point of view. And as a result, there are various requirements on the metropolitan planning organization that we'll be going through here. One of the biggest jobs that YMPO has is essentially transportation. And I beg your pardon. Should I?
Yes,
is it okay to remove the mask?
Yeah.
When it comes to transportation, the biggest provider of transportation on a regional basis is the Arizona Department of Transportation. But from that point of view, the vast majority of the transportation work that is done directly by members of the YMPO. In this particular case, the cities, the towns, and the county. Your own Department of Transportation spend far more money from that point of view in keeping the system going. But just very briefly, looking at the Arizona State Transportation Board. In this particular case, although the graphic's not particularly clear right now, there's a large system of roadways, obviously, through the state of Arizona. We have interstates, we have other state routes, we have other freeways. In our region, in the Yuma County region, the problem is we don't have very many state routes. That is a problem that will be coming up shortly. However, the State Transportation Board is responsible for establishing the state highway system and nominating state routes. They have been given policy powers by the governor of the state of Arizona. Next, please. The State Transportation Board. I'm going to not concentrate on the State Transportation Board, but this particular presentation does actually cover the recent actions by the State Transportation Board, and in particular, the State Highway Program, which was recently released. In this case, the State Transportation Board gets about $800 million in federal funds every year, and about $1.5 billion in, I beg your pardon, 800 in federal and 1.5 billion in state funds. Those are all, nearly all, coming from gasoline taxes or fuel taxes, and we'll go into that in just a short while. For the federal funds portion, you've basically got $80 million going to the Maricopa Association of Governments and the Pima Association of Governments. This particular case, the Phoenix area and the Tucson area. They get $80 million direct, effectively from federal legislation, and the Arizona Department of Transportation don't have a choice as to whether they get them. They go direct. In this case, MAG and PAG, as part of state legislation, get almost 50% of the remaining discretionary funds that ADOT have. I'm happy to say there won't be a test on this, but luckily you'll understand a little bit more as to why this is important very soon. So ADOT, the Arizona State Transportation Board, or ADOT, get to decide on the remaining $280 million of federal funds. They actually allocate less than $10 million to the rural MPOs, the Metropolitan Planning Organizations, of which Yuma MPO is the largest of them. Less than $10 million every year is allocated for our decision-making process. As a result, in this particular case, YMPO receives just over $1 million in this case, it's a surface transportation block grant money. It's just about $1 million, and we get to decide effectively where those funds go. Although, of course, since they're federal funds, there are limitations. Next one, please. So, looking at federal transportation funds, the little purple piece at the bottom, that is YMPO. You've got a huge chunk of money going to MAG and PAG. Since those two organizations between them have 75% of the population of the state of Arizona, that kind of sort of makes sense. However, with less than $10 million coming to the rural MPOs, we're pretty much stuck as to how we actually do anything with that $1 million. That may sound a little bit odd, but when you're talking about $500,000 per lane mile, there's not very much you can do with the $1 million. Next screen, please. This particular one, we won't be going into a massive amount of detail, but this is something that ADOT, by the way, just in case you think I'm knocking ADOT, they do very well indeed. This particular graphic was actually sent as a separate graphic to the county clerk, and I'd be happy to provide separate versions of it. At the top, you have this big gasoline tank, and it has 6 different ways of putting money into the Highway User Revenue Fund pot. These are state taxes. I won't go into them in detail, but suffice to say the largest portions by far are gasoline tax and use fuel tax. Use fuel is diesel tax. A very big portion as well is actually vehicle license tax, but that is likely to be changing in July of this year. As you can see, a bunch of the money flows down, gets diverted off into different areas, and then eventually flows down to the State Highway Fund. And at that point, that's when ADOT starts to allocate the funds. Next screen, please. Effectively, $40 million comes off the top. The next step, and this is where the vast majority of the funds coming to the county and to the cities and towns and the members all the way around the state, the county get $273 million, sub-allocated, based primarily on population. Cities and towns receive almost $400 million. But then there's another takeoff off the top, beg your pardon, not off the top, as part of this, to cities over 300,000. Effectively, we're talking the larger cities and towns as part of MAG, and in this case, the city of Tucson, for example. Another $100 million goes to MAG and PAG because apparently they're not getting enough. And since I used to live there for many years, I don't live there anymore. I know that they really appreciate that. The next step, the biggest portion, and I'm sorry I forgot the dollar sign there, goes to ADOT operations. Someone has to pay for ADOT to do their job. And when they do their job, they actually do a very good job of maintaining the system, I have to admit. But that actually takes a lot of the remaining money that they have available. And then after debt service has been taken out and some other costs, the only money available from that $1.5 billion to start, statewide projects essentially get less than $170 million. Actually, it's a little bit more than that, depending on the year. The numbers that I'm using by now, right now, are 2020 money. Next, please. Again, we won't focus in on this too badly because it's a little bit, but this is what ADOT puts out with regard to where the money is going. And they actually allocate it not necessarily directly by state, but that's how they have it listed. And at the moment, the big arrow that points to is $2.6 billion spread over the next 5 years. So that's just over 500 million a year. And that is going to statewide projects. So $500 million to statewide projects. About half of that isn't actually allocated to individual projects. And the vast majority of that money is allocated to projects in the first 3 years. The last 2 years, as you can see, beg your pardon, certainly, well, the last 2 years, the vast majority of the money is not allocated to individual counties. And when I say allocated to individual counties, the state transportation board selects the projects in those counties and they direct the money to those projects. That's where the problem comes. In other words, the counties don't have that much of a say in where those projects are. Next one, please. So, total transportation funding for Arizona. MAG and PAG have a very, very large share. But when the total funding for Arizona is then split between the remaining counties, and in this case, the important part of this presentation is I'm not looking at the money going to the MAG and PAG region. I'm looking at where the money goes when it's sub-allocated to the remaining counties, and especially, obviously, Yuma County. In the 2021 to 25 program, which is the program that was just approved by the State Transportation Board, Mojave County is getting $247 million. Yavapai County, you can see the rest of the numbers there. Yuma County gets 64. I have a little bit of a problem with the fairness issue when it comes to that. All of the others combined, as you see down the bottom, get 171. But when you bear in mind that there are 13 counties that are not either Maricopa or Pima County, the share gets incredibly small. Next screen, please.
Paul,
yes.
Do you want to elaborate on those 64 million that Yuma County is gonna get? Because obviously some people might see 64 million and say, well, that's a lot of money for Yuma County, but it's for 5 years or 4 years, and it's a program that it's basically that the state's going to tell us how to use that money.
Thank you, Mr. Chair. Members of the Board of Supervisors, that effectively is 2 projects. The vast majority of the money in that amount of money goes on 2 projects in the state itself. And actually, in the next portion is really where I'm focusing in on the unfairness issue. As it turns out, also together with that big graphic of the trickle-down effect with where the highway user revenue funds goes, I also gave a presentation to the YMPO Executive Board, and I prepared that analysis of which projects in the Yuma County region have been receiving money as part of the state transportation system. So, in this case, the State Transportation Board, or ADOT in this case, allocate funds based on need, what they decide the need is. Generally, and this is a little bit of a generalization, I know, but generally the need equals the lane miles on the state highway system in each county. And as I said towards the beginning, Yuma County has very few lane miles of state routes. So, surprise, surprise, we don't get that much money. Now, it's not a precise, ADOT doesn't only program projects that way, but that's generally where the amount of money goes. Now, although we contribute in our region taxes into the federal and the highway user revenue system, we don't get the same amount of money that we put into the system back from the system, primarily because of this need. So, arguably, drivers in the YMPO region subsidize other counties, their highway systems. Now, that's one way of putting it. If I was the ADOT director, and that's probably not likely to happen, but if I was the ADOT director, I'd probably go back to number 2 up there, and I would probably target the money based on the number of lane miles in each county. However, next one, please. So, doing a comparison between the 3 counties, they all just happen to be on towards the west side of Arizona. They all have similar populations. Mojave County, Yavapai County, and Yuma County. They all have similar populations, and we all pay similar amounts of money into the state system. Over the past 20 years, I didn't just do 1 year. Actually, I went back 23 years. On the past 20 years, and again, I should point out this is where ADOT does a very good job of keeping the information available. So Mojave County has received, on average, $27 million a year. Yavapai County, kind of sort of similar, 32. Yuma County, no, 13. We're getting less than half of what the other 2 counties are getting. And more importantly, in the most recent 21 to 25 program, Mojave County is getting $49 million each year. There is a reason for that, and that basically has to do with Interstate 15, which I think most people would have no idea where Interstate 15 is. However, it's a problem. There are a lot of bridges on Interstate 15. The state of Arizona doesn't have a choice as to whether they have to maintain it or not, because they do. And as a result, they're actually committing quite a few resources on Interstate 15 to bring it up to scratch, so to speak. Bridges, you don't mess with bridges. You have to do them as a priority, is a simple way of putting it. That's the reason why Mojave County's $49 million a year is incredibly larger than the other 2. However, Yavapai County's still receiving $22 million during the normal 5-year program. Yuma County is only receiving $13 million a year. So in comparison, bearing in mind, all 3 of us are putting in about the same amount of money into the system. We're not getting our fair share in return. And again, I'm not looking at MAG and PAG. Between them, 75 to 80% of the population is right there. However, next step, please. So the problem is lack of funding. And part of the problem is because the elected officials in this county don't pay your fair share of gas taxes. Sorry, man. You don't pay your fair share of gas taxes. Okay. Now the truth. None of us pay our fair share of gas taxes simply because they haven't been increased in the past 30 years. I don't either, from that point of view. I would do if I had the chance. It hasn't been increased in 30 years. So, for example, 1990, when effectively they were last increased, gas tax was $1.15. We were paying round about 37 cents a gallon. That seems an awfully high percentage in taxes. But guess what? 2021, it's well over 2.5 times the amount right now, and we're still only paying 37 cents per gallon. It just so happens in the state of Arizona, about half of that goes to the feds, most of it comes back, and half of it goes to the state. And unfortunately, as we've discovered, not most of that comes back to our county. In addition, vehicles are driving 60% more miles for the same gallon of gas. As a result, basically, transportation, and that includes our county engineer behind us right now, transportation only receives about 1/4 to 1/5 of the money that they receive for every single mile traveled on the system than we were 30 years ago. Those are the numbers that I've got coming out of the system. Okay, what do we do about it? Next one, please. The symbol on the left is the YMPO Long Range Transportation Plan. It's one of the big studies that YMPO, the MPO for Yuma County, has to do. So over 80% of the state of Arizona currently has a half-cent sales tax. Yes, there it is. Not a particularly nice way of saying it, but they currently have a half-cent sales tax for transportation. That includes the MAG region, the PAG region, Pinal County, for example, and Flagstaff. It also happens to include the city of Yuma. They have a half-cent sales tax for transportation purposes. However, the remainder of the YMPO region does not have a sales tax. As a result, we don't have the ability to effectively control our destiny when it comes to the funds that we raise. To a great degree, we're reliant on the State Department of Transportation for funding some of our roads. However, in this particular case, and I have been discussing this starting to discuss it more at the political level, I've been discussing it at the managerial level, there is a possibility of coming forward with a half-cent sales tax for transportation. It obviously has to go through a lot of discussion, and it will have to be an election, part of an election. But it occurs to me as if 80% of the population of the state of Arizona has identified that need. Shouldn't we also be looking at doing that in our region, and there, from that point of view, controlling more of the needs that we have in Yuma County? Mr. Chairman, that concludes my presentation for the time being. I'm sorry it's been a little bit one-sided. YMPO does a lot more than this. I will say in my defense that we're moving right now, and we have our, all of our computers unhooked up and such like. But I will be giving a similar presentation, not precisely the same, to the other cities and towns, with the blessing, obviously, of the individual councils. But this is an effort that is moving forward. By July of this year, we will have the long-range transportation plan approved. At the moment, we are looking to identify what we will do with that half-cent sales tax money if it should be approved at an election. The election we're probably looking at right now, I believe, is November 21. 21, I believe. I'll take that under advisement, if I may.
Thank you, Mr. Ward. You know, just a few comments. You know, some of the numbers that we saw today, I mean, obviously millions of dollars, but you explained it really well. But there's still going to be some people out there that are going to say, well, Yuma County, the cities receive a lot of money. Why is there so many potholes or roads in our county or in the cities that are not taken care of? But in reality is that we don't receive all that money. There's a certain amount of money that we receive, and it takes care of all the employers that each cities and counties have, but also to maintain the roads. And like you said, 1 mile is very expensive to do brand new, and to maintain it's expensive. But to rebuild a 1 mile, it is really expensive. So I just want people out there to know that it's not all that money goes into the county or to the cities, and that we're not putting it into the roads, fixing those potholes or those streets that really need repairs. So it has been a long time that the gas tax has not been increased. Just a question, just so that you know everybody else out there knows, a half sales tax in Yuma County would generate.
In this particular case, I understand the half-cent sales tax in the city of Yuma generates around about $12 million a year. Does that sound about right? Okay. That's my understanding.
Mr. Chairman, Yuma County sales tax revenues this past year were $17.7 million. So that would be the sales tax that would apply, because it goes throughout all of Yuma County, and that's the sales tax that we would be talking about.
About change.
I understand that the city is around about 45% of the total population of Yuma County, so that would be very, very close to the numbers I think I would have worked out. But Mr. Chair, one thing I should have added, there have been attempts at the state level to increase gasoline taxes. Unfortunately, consistently over the past 30 years, they've been turned down, including one attempt this year to increase the gasoline tax by 1 cent per gallon per year for the next 25 years, which I thought was a relatively easy way of taking care of things, just 1 cent extra per year for the next 25 years. That was turned down, I'm afraid. There are also discussions at the federal level. Actually, just today, Secretary Buttigieg had come up with an idea that we need to have some sort of additional levy. Not using the word tax, user fee is the favorite one. So there are ways in which we can potentially take care of this, but the graphic or the bullet point that I had up there of basically we're only paying a quarter to a fifth the amount of money that we were paying 30 years ago into maintaining roads is probably the best way of explaining what the problem is right now. So, and I've got to tell you, Yuma County, as far as I'm concerned, and indeed the cities are doing a fantastic job with the incredible lack of resources that they have.
Thank you, Mr. Ward. And yes, they do that. Any other comments or questions from the board, from Mr. Ward? Just the last comment that whatever if this goes through and the voters decide either way, but if they decide that we do this, that it goes through, that money that will be raised by cities and the county will be used for local roads. At least that's my understanding, that we have more of an opportunity to put more money into our local roads and streets.
That's, in this particular case, all the discussions we've been having to date focus in on the local use of the funds raised within the agency where the funds were raised to start with. So yes. As to whether there should be a portion taken out of that for regional types of projects, well, that discussion has not yet occurred. So.
Thank you, Mr. Ward.
Thanks, sir.
Moving on to consent agenda. Have 1 through 9. Any supervisor wants to remove one or talk about one? If not, I'll entertain the motion. Yes, go ahead.
The staff would request that that the board continue item 7 to a future date not specified.
Southwest Aspen.
Okay, so it'll be item 1 through 9, excluding item number 7, and continue that to another date.
Mr. Chairman, I'd like to pull number 3.
Number 3. Okay. Is there a motion to approve, or any other ones that you want to pull? Anybody else? Item 1, 2, 4, 5, 6, 8, and 9.
Move to approve.
Second.
There's a motion and a second to approve items 1, 2, 4, 5, 6, 8, and 9. All those in favor say aye.
Aye.
Any opposed? Motion carries. Item number 3. Mr. Lyons.
This question is for Susan. I just wanted a clarification on the discussion regarding the grant. And I think that was in our February 17th meeting where we were going to, we had a few questions and we had not approved moving forward with WACOG at that point in time.
Yes. So that is a lack of communication on my part, and I apologize for that. What I would like to do, officially, the board's action was to authorize the county administrator to enter into an agreement with a party that wasn't named at that time. So that was the official action. You did ask for some more information to come back. Nancy and I researched the information that you had asked for and gave that to me. I did not convey that to the board. So we're moving forward with it. What I can do is bring it back on March 15th for you to look at and ratify and get all those questions answered, if that would be helpful.
Yeah, I would like to hold it and not move on anything until those questions are answered, please.
Okay, so we would hold off on launching the program until
Right.
after that.
Just so that we'd asked for some analysis based on what the city had done, and I just wanted to have that information before we authorized it and move forward.
Nancy was here earlier, and I'd asked her to be here, but I didn't know whether we could talk about it. I knew we could to a certain extent under call the public only for information purposes, but since it came under those minutes, we'll be able to do that and bring it back on March 15th.
Okay, thank you.
Hold off on the launch of the program until after that.
Thanks.
Any other questions on item number 3? So we'll go ahead and do we need a motion on that to hold on?
Mr. Chair, I move that we hold items number 3 and number 7.
No, you're approving the minutes. This was a separate subject.
Oh, under the minutes. Okay.
Yeah, so you would do a motion to approve the minutes.
Yes, okay. Mr. Chair, I move that we approve the minutes from February 9th and February 17th.
Is there a second?
I'll second that.
There's a motion and a second to approve the minutes on February 9th, 2021 and February 17th, 2021. Any other discussion? If not, all those in favor say aye.
Aye.
Any opposed? Motion carries. Do we need a motion for item number 7 to be moved? To continue, okay.
Mr. Chair, I move that we continue item number 7 with South Gas.
Motion to continue item number 7 on a future date.
Mr. Chairman, you need to provide a date certain to when you're going to continue this.
And I had a question, Mr. Chair. Can we get a little bit of an explanation on the continuance there?
Mm-hmm.
So I want to commend Chris Young and Ian McGahee for working closely with Southwest Gas. I'm not sure if anyone's here from that organization, but we did notify them. After a lot of back and forth, there is a difference in approach about how to best identify the conditions of a franchise and what form that document should take. So the county attorney's office and the county engineer and the deputy county administrator are going to be working through that, make sure that they come up with something that's mutually agreeable. So we want to continue this agreement until after that time. And Chris Young has let Southwest Gas know, and so of course they'll be involved in the final documentation to make sure that it meets our needs and complies with franchise requirements.
Okay.
So do we need a date or
Mr. Chairman, I need to look at the statute because this was, notice was given to the public that the franchise would be considered today. So that's why I think.
Right, but it can be, by continuing it, we're noticing the public that it's being continued. To make it easy, why don't we continue it to March 15th? And then if we need to continue it after that, we can do that.
We do, yes. Okay.
Does that make sense?
Do you want to amend your motion on that?
Yes,
Mr.
I amend my motion to.
Mr. Chair,
Okay.
may I?
Go ahead.
Just one question. We are already beyond the franchise date expiration, correct?
Mm-hmm.
How far beyond are we?
It expires?
It expired 5 years ago. So we've been operating under the existing under existing franchise until it's replaced by another.
Okay. Can I ask why we've delayed it 5 years?
I have no idea. I cannot answer that question.
I wasn't here. Susan, you weren't here. Does anybody else have an opinion as to why we kicked it down the road 5 years? Anybody from the county attorney's office?
Trying to catch up with
Okay.
past elect.
Supervisor Lyons, that's been a lot of my questions in the last 4 years.
I commend you for asking that question. I just wondered why we kicked it down the can 5 years.
The one that could probably answer it is not here.
Yeah. We'll get him on next meeting.
All right.
All right, Lynn, you wanna?
Yes, I amend my motion to extend continue this number 7 till the March 15th meeting.
Is there a second on it?
I'll second.
There's a motion and a second to continue item number 7 to March 15th meeting. Any other discussion? Seeing none, all those in favor say aye.
Aye.
Any opposed? Motion carries. Thank you. Moving to items, discussion and action items. Item number 1, County Lynch Public Health Service District. Go ahead, Tony.
Vice Chairman Porches, board members, Tony Padilla, Yuma County Emergency Management. Mine's going to be short and brief. This weekend, we held the Saturday testing at Arizona Western College. We had 120 people registered. We had 17 cancellations. We registered 36 people on site, and we had 139 tests completed. We had assistance from AWC's fire, EMTs, and the nursing students, ASU staffing, National Guard, Task Force Med, and Logistics, Emergency Management Volunteers, the CERT program, and Red Cross. Other things Emergency Management has been doing during the last couple of weeks, continue to assist with offloading PPE. I'll take my mask off, it's hard to breathe in this thing. Support with equipment for supplies for the vaccine events, coordinate with YMCA, continue to support them in any type of requests that they need. And I think I mentioned this last time, that the National Guard assets are available until the end of September. And then I continue to meet with the state, county emergency managers on Tuesdays. And one of the things I'm really excited to talk about is I've been meeting the last couple of weeks with AZDEMA and some of the other government agencies. They've been looking for another state-run point of dispersal. They have identified YMC's current site at the Civic Center in cooperation with the City of Yuma and YMCA. They're in the negotiation to start a 24-hour, 7-day week pod.
Oh, that would be wonderful.
I met with them last Friday, the City of Yuma, Fire and Police, and YMCA, and they are working on the negotiations. Looks like they can do 3,200 a day, which would then equal about approximately 9,600 people a month getting a vaccine. One of the things they are looking at doing, and it's up to the state, is to tap into the Johnson & Johnson. So if they tap into the Johnson & Johnson, that's a one and done. Doesn't mean they won't continue to do the Moderna vaccines, but they're going to do the Johnson & Johnson if possible. So that would mean one and done, and they don't have to come back for a second visit. Let's see, those who were involved were the ASU CEO, Dr. David Thomas, Colonel Leeper from the National Guard, he's a state surgeon, and then Sheldon Ross from AZDEMA, who I've been meeting with. They expect maybe mid-March if they can get everything worked out. So as you know, I think Johnson & Johnson was released on Saturday, and so we're hoping that may be one of the options for us. And one of the things that concerns everybody is that these allocations will be the state allocations. They should not affect our county allocations that we're currently receiving. So it should not take away what we're receiving from them.
It would augment.
Yes, sir. Any questions on that?
And, Mr. Chair, and maybe Diana could address this as well. And I was also told that because the restrictions had been lessened on the storage of the Pfizer vaccine, that we would also receive an additional allocation for that, to where we could hit 100,000 in 1 month.
Good morning, members of the board. So you are correct. The Pfizer, there's a greater degree of flexibility now as far as storage of Pfizer vaccine. So we had mechanisms in place. It's just harder to handle. There's a lot less flexibility, but yes, the lessening of the storage requirements does provide a greater degree of flexibility, which would allow for more deployment on the field. The ultra cold storage has been reduced to a more flexible level.
Thank you. I just wanted to commend both of your efforts, having been on those calls and having talked to our federal people and our state people. I mean, seriously, you guys have done an amazing job putting this together and taking care of the people of Yuma County and those who might be visiting here from other places during our nicer weather. But thank you for an exceptional job.
Definitely, Tony, thank you and for all your work and getting this ready. So this is great news. Anything else you want to add before Diana takes? That's it? Okay.
No, I'm done. That was it.
All right. Well, thank you. All right.
Okay, good morning.
Good morning.
So just to give you an overall perspective on the vaccine administration, we've administered locally about 43,000 vaccines, and about 19,000 of those have been in the 65 and over, which means we've done a really good job of protecting those people that we set out to protect in the very beginning, our most vulnerable population. You heard information regarding the testing numbers from Tony. Today we are reporting 20 cases out of 68 tests. So I really, really want to highlight the importance of continuing to get tested. I know that there's lots of reasons where the testing numbers have gone down. There's COVID fatigue, people are kind of over it. There is a shift in focus from testing to vaccine. That's what people are concerned about right now. But I want to remind everybody that testing remains a critical part of our surveillance strategy, and it allows, particularly because we know so many people are asymptomatic, so if you believe you've been exposed, it's important that you get tested. Testing gives us an idea of where we're at as far as positivity rate, and that's important, particularly as people are trying to make decisions about lifting some restrictions, maybe having more flexibility, expanding capacity, things like that. So it's important that we do that. It also provides a good mechanism for us to identify variants. And so if we don't have a robust testing response, then we're working with a smaller sample size, which makes it difficult for us to catch whether there are variants circulating, COVID variants circulating in our community, which hampers our ability to predict it or prepare for another surge. So right now, our positivity rate is trending down, which is good. We want to keep those numbers. The vaccine, the arrival of the vaccine provides another tool. As you heard earlier, the Johnson & Johnson vaccine was approved this weekend. The Johnson & Johnson vaccine is a one-dose vaccine, which is really different than the Pfizer and Moderna, which you've seen earlier, which is a two-dose vaccine. So it was authorized for use 18 and over. Again, it's a one-dose vaccine. It was proven 72% effective, 66% overall effective in preventing moderate to severe COVID-19 cases, and 85% effective in preventing severe disease in hospitalization and death 28 days after administration. This is very different than the Pfizer and the Moderna, but keep in mind that they had a higher efficiency rate after 2 doses. So, you waited your second dose, and then 2 weeks later, you could expect a 95%. This one does, the 72% within 1 dose, 28 days after the dose. And really what you need to look at is the 85% in reducing, the hospitalization rate as well as the severe reaction to it, or to the COVID virus. It's also important to note that there's differences between when you look at these numbers and you're thinking about which vaccine to pick. It's important to note that the clinical trials were conducted differently as far as time sequencing. The Moderna and Pfizer vaccine were tested much earlier. The Johnson & Johnson vaccine was tested later. Their clinical trials were later. and they were tested once multiple variants were identified. And so when you look at those rates, it's just a different point in time. So it's important to keep that in mind. And again, this vaccine is an ideal candidate if you believe that you may not be available for a second dose, or you think there's an issue and you prefer this type of vaccine over the other. Again, what we're focusing on is the overall effectiveness of preventing severe illness. It's a little different than the other two vaccines in that the Moderna and the Pfizer were a messenger RNA vaccine. This one uses a weakened cold virus, not a COVID virus, so it's not possible for you to get the virus from getting this vaccine. It's a mechanism that's used for flu, so it's something that's not new, it's something that's very familiar, true, and tested. So again, if people have some hesitancy, just know that it's a method that's been used for vaccines and it's tried and true. So it's a safe vaccine. The side effects that we're seeing are very similar to the ones we saw with Pfizer and Moderna, which is soreness at the injection site, some fatigue, possible headaches. So again, very consistent. And again, when you look at those numbers and you look at the rates and how they compare to the other two vaccines, just keep in mind again that the efficiency rate is high for a single dose vaccine, and that again, it was tested at different points in time. And so that when the other two were tested, there wasn't as many variants available. And so this vaccine has proven that efficiency rate and that effectiveness rate when you had all those things in circulation. So again, we will hear back from the state. It's estimated that supplies will be initially limited, but again, as production ramps up, there's a good possibility that we will get them within, just hopefully early this week. We will find out again from the state. But again, it just provides a one-dose option, which again is a game changer. The storage requirements are a lot more flexible. It could be stored in a regular refrigerator, and it could be stored for up to 3 months. So again, just greater degree of flexibility than the other two vaccines. So just another option. I can answer questions.
Mr. Chair, did we ever establish a baseline as far as tier A and B in one, as far as meeting the requirements for the 65 above, and then on B, 55 and above? What do you estimate as far as the general population, how many people we have left in those tiers before we can start administering outside of those tiers?
That's a good question. So yes, we were looking at that this morning. So fairly confident that, for example, the prioritized group A, which was the healthcare providers, that we've done a really good job of vaccinating everybody that wanted to be vaccinated. And that's the caveat. Everybody that wanted it has been offered and had an opportunity to receive it. Then we moved to the prioritized 1B, which was, again, law enforcement, childcare, education. I think we're wrapping up. I think we're finishing that up. We're doing second doses for a lot of our educators. I think within this week, everybody has at least received their first dose. A lot of the focus is now turning to second doses, but I think that segment of the population is pretty covered as far as we're concerned as looking at the numbers and as far as the appointments are scheduled. So we're hoping that within this next 2 weeks, we can wrap it up and open it up to the rest of 1B, so we can move to the rest of the essential workers and some of the other people that have waited incredibly patiently, and we can start vaccinating those. So anytime between the next 2 weeks, we're hopeful to expand that criteria. And again, the goal is to get vaccines in people's arms, so the sooner we can go through the process, the sooner we're better protected. And this vaccine provides another mechanism and another source of vaccines. Also noting that our vaccine retail pharmacy program has expanded, so thank you for everyone. I know all of you actively advocated for that expansion. So you can go to the ADHS website. In addition to the health district and our partners like YMC who are providing clinics, or Sunset, you can go to this website and you can see that we have local pharmacies, CVS, Walgreens, Albertsons, and we saw Albertsons when they got their distribution last week, stood up a clinic the very next day, and they went through about 500 doses. So we're going to start seeing more of that. And that's good because that provides additional options. Again, some of those vaccines, you need to note that, for example, the clinic that was held at Albertsons uses Pfizer vaccine. A lot of the retail pharmacies will have a mixture of either Moderna or Pfizer. So again, just multiple points of dispensing. And again, we're working really hard to make sure it's equitable. So we just hosted a clinic in Somerton, San Luis this weekend. And again, making sure that regardless of where you live, you have the ability to access the vaccine, and things like transportation or lack of a pharmacy close by are not a barrier.
During our Friday call, I'm sorry, Lynn, were you going to say something?
No,
Okay.
I just said,
During our Friday call, you stressed to our partners the need to make sure that they were keeping that secondary shot instead of using additional shots or additional allocation for a first shot. And I think that we need to continue to stress that so that people aren't throwing up their arms saying that they're not getting enough vaccine when the allocation remains the same. It's just that they've been using those secondaries for a primary.
And that's important moving forward. And I think it's important for the public to know that if we continue to get the same number of vaccines, at this point, we're working 28 days back, and we have to set those vaccines aside. And I know that's frustrating when the perception is that we're getting additional vaccine, when in fact, it's just to complete the series. Again, that's why that Johnson & Johnson vaccine provides that option.
And we had a freak weather storm, in Texas, that if there's any additional hiccups, and you go beyond those 28 days, and it complicates the system significantly, and then, we have to get a lot more people involved. With school going back in with the high school and District 1 today, can we talk about the wastewater?
The wastewater surveillance program?
Yeah.
Yes, so you might have seen, you might have noticed our first announcement, I think it was about 2 weeks ago. So again, the University of Arizona, led by the Center of Agricultural Excellence here locally, is conducting wastewater surveillance. And so what they do is they're collecting samples. When it's above a certain, they establish a baseline. When it goes above that baseline, they issue a warning that basically says you have a higher level of prevalence in the wastewater. Again, in the wastewater, because I think there was confusion and people were understandably contacting our office and asking if they needed to boil the water. But again, it's important to note that this is the wastewater.
Yes.
And so all that does, it's another surveillance system that basically says, this region, you may all be asymptomatic, you may think there's not, but there's a higher prevalence detected, which means it's a good idea for you to be tested. I answered some questions and people asked, will you be contacting houses individually? No, we have no way to do that. It's just what comes into that plant. And so when we highlight a neighborhood, that is a neighborhood that's served by that wastewater processing plant. Not necessarily that neighborhood, necessarily, it's that region that's served by that. So no, not individual addresses, and we have no way to tell that. But again, it's a way to just tell people you need to use enhanced surveillance, not a time to kind of let down your guard. Just be cautious, and again, just a preventive. The value of that is that it can detect levels up to 2 weeks in advance. So we just know we have to be extra vigilant. People can get tested. Again, testing is important, and then we ensure we can keep operating safely. And for the schools, it just means getting kids back in the classroom now that the teachers are vaccinated and we're doing all that stuff.
Thank you. Thank you for your efforts there.
Just to kind of expand on what Jonathan said, I was going to bring that up because I've gotten numerous calls from the people in the Del Oro area where it popped up. Can we put out something just basically to what you said, whether on the paper or something? Because I do. People are concerned now because all of a sudden we're saying it's present in the wastewater, and can we get it? And we just need to reaffirm to the public that just because it's testing positive or there's a higher content in the wastewater, it's not going to per se affect you.
Right.
Because like I said, I've gotten numerous phone calls.
And you know what, and I'll own up to that one, because when we got the first results, we try to share the information as soon as possible. So it's like, okay, we had an elevated result, we need to report it. And when you do this all the time, you kind of take it for granted. We threw in 3 sentences and just very basic, but you're right, yes. We'll expand on that
Just
to clarify.
expand on so the public understands what it is. We understand it, but a lot of times the public doesn't, and it kind of puts a little bit of a fear into them.
Yeah, and we had that on this red zone where we blocked out. But again, it's just that region.
Yeah. Mr. Chair and Diana, can you tell me how many teachers, do you have a percentage of how many teachers have had at least their first vaccine and maybe their second?
So the majority, I can't give you an exact percentage, but I can tell you that we've worked with all the private schools as well as all the public schools. And the one school that's getting vaccinated this week is Gadsden Elementary School, and they're getting their first dose, but everybody else has worked through the system, gotten their first, and are working on their second dose. So same thing for the private schools. Everybody that wanted the vaccine was offered the vaccine and has gone through that process. So as far as teacher vaccinations, we've done a pretty good job with coverage. We've also worked, I know we're hosting a clinic for childcare providers this weekend, some childcare providers that might have not had a previous opportunity, but again, really mindful of that. In our next focus, we'll be again working to make sure, like just one more push to make sure we catch everybody. But again, there was some hesitancy, just like there was with healthcare providers initially, where they were like, I'll wait and see.
Yeah.
So this was like, we need to move to the next priority phase. So
Yeah.
one last call, and then we're moving forward to make sure we expand that.
Okay. And the reason Gadsden is getting theirs is the delay because of the storms?
So, no, the other schools were open before. Gadsden is opening as well. There's a push across all the schools because there's standardized testing that needs to happen. And so, actually, we're partnering with Albertsons, and we're going to go ahead and Albertsons is going to do a dose, a first dose clinic for them. And the beauty of that is, for the most part, when we've had any type of vaccine, we can't get to the whole group at once. They'll be able to do one mass vaccination clinic in Gadsden at their site and just vaccinate all their staff all at once. So that
really
makes
good.
it better, so that we don't have to break it up over
Yes.
multiple clinics. Yes.
Yes.
And so once that's completed, then at least from a public and private school perspective, we just do one more call, and then we make sure make sure that everybody's covered.
Good, thank you.
Yeah, that's good to hear, Dana. I got several calls from teachers in South County, you know, and basically when they heard they were chosen by lottery, and I said, I never heard you say anything about that.
We weren't involved with that.
Yeah. So my other half works for Gadsden District, and when she heard that, it was like, what did you do? You know, it's like, I heard, lottery, you mean this is not a game, or this is not, you know, so that word really it shouldn't have been used. Groups or by opening up, if your school's gonna open, we try to, you know, get it, but using that word lottery, and I explained to many that at least not by the county health director was that word ever used.
All we've done is what we've tried to do from the very beginning is set aside whenever possible X amount of appointments to facilitate and expedite the vaccination of those identified priority groups, which is what we did. So every week we were like, we have X amount for educators, and then that was coordinated with the superintendent's office in conjunction with all the school superintendents. So that was an internally decided process, again, with all the school superintendents participating in that decision. So again, we were just saying we can help expedite that process, which again is what our pharmacy partners are doing. So.
Well, thanks.
Thank you.
Thank you. Any other questions? You guys are doing great, so thank you. All right. Moving on to item number 2, Human Resources. Recommend to the Yuma County Board of Supervisors to approve the premium rates and plan design changes for the Yuma County Employees Benefit Trust for plan year 2021-2022. Alicia?
Good morning, Vice Chair Porches and members of the board. Felicia Frausto, Human Resources Director. As you may recall, on February 9th, myself and Mark Fitch from Siegel Consulting presented to you the premium rates for plan year 21-22. It was then concluded at the end of that board meeting that the overall Board of Supervisors made the decision. I'm going to flip to slide 22. Thank you, Amelia. As you'll see here, we presented at that time, we provided to you 4 different options. And of those options, it was concluded that the Board of Supervisors would look at option number 4, and that was increasing deductible across all plans. Plan option A, 200, plan option B, 200, and a high deductible health plan, delaying the 1% differential shift, and then utilizing some of the reserves at the expense of $330,000. During that presentation, Mark Fitch and myself also presented that there was one other option that we wanted to provide, which was option number 5, but the actuary was not able to provide an example at that time. And example, option number 5 was increasing plan option A for up to $300 to the deductible. So presently it is $600, adding $300 more, so it'd be $900 non-deductible. Plan option B and the high deductible health plan would only increase $200 for their deductible. So $1,000 for the PPO option B, increasing it to $1,200, and the high deductible health plan was $1,500, increasing that to $1,700. We would still delay, but we did not have the numbers with regards to what the cost it would have an impact to the reserves. So that's $290,000. With that conversation, we also had met with the Employee Health Team Committee. And what we had identified as well is that through the process, we heard from our consultant that plan option A has for various years has always received the subsidization from plan option B and high deductible health plan. And I am a person who is on plan option A, so I utilize it. And that does mean that I utilize it for medical reasons. So wanted to be able to say that as a plan option A participant, also wanted to look at how could I actually contribute so that this way it becomes somewhat more of an equal across the board. We went back to the consultant late last week, Monday, and we asked for option number 6. Option number 6 says that it will still increase plan option A by $300. Plan option B would increase by $200, but we would have no cost to increase to the high deductible health plan so that it would remain at $1,500. We would still delay the dependent costs, shift of that 1%, and we would eat into the reserves by $310. So that's still less than $20,000 that we had originally stated in plan option 4. We presented this information to the Yuma County Board of Trustees on Thursday of February 25th. They are also recommending that we as the plan would also select option number 6, so that this way we can truly help align the options across. And then there might be some interest why employees would move from plan option A to B and individuals on B to the high deductible health plan. So with that, we did also inform the trustees that we would also be increasing the medical benefit under the SSA Mexico plan. And they also agreed with that, as you'll see there, the additional medical benefits. So we're increasing the individual amount from $3,500 to $5,000 and $7,500 for the family to $10,000. So today I present to you this information, the recommendation from the Yuma County Board of Trustees and representation from the Employee Health Team Committee. They're also in agreement with option 6. So now I would then share this information with you and ask for what your recommendation to approve.
Mr. Chair and Felicia,
It's
option 6 is equalizes how much everybody's going to be increased.
Yes.
And so all the employees would feel the difference, not just B and the high deductible.
And I will go to option number 6 here so that you can actually see what that would look like. And you're so kind that she does that from, thank you. As you'll see here, what that cost impact would be, you'll see to the far right-hand side of this slide here, let's see if I So the cost itself remains the same on all plans, but it's showing how much I, as the employee under plan option 1, how much I'm actually going to be giving. The payment amount stays the same, but I'm actually contributing more to the deductible. So as my cost for my medical benefit, usually I'd have to meet that $600 deductible. My max out of pocket is $4,500. Now my deductible is going to be $900, so my max out of pocket is going to be slightly more, but I'm contributing more into the plan, whereas plan option B and high deductible health plan has been subsidizing that cost.
Yeah. In the past.
In the past.
Can you give me some, Mr. Chair and Felicia, can you give me some numbers on how many are on each plan? How many employees?
Yes, I can. As you'll see
I'm
here,
sure it's in there, but it's so
so
small.
here we have currently 534 employees presently on PPO option A,
Okay,
414 on PPO option B, and
Okay.
240 in high deductible health plan.
thank
And
you.
this is a really good numbers when it comes to our high deductible health plan, because this is now just our 4th year going into the plan. And so we've seen each year a shift of employees who are understanding how to utilize a high deductible health plan. And we provide the education from Blue Cross Blue Shield. We do lunch and learns for that. We also have with our health fair or our virtual health fairs that we've been putting on, they will actually meet with someone from Blue Cross Blue Shield to understand the program.
Thank you.
You're very welcome.
So Felicia, there's gonna be an increase to the employees, what they pay out of pocket, but it's gonna go towards the deductible?
Go towards the deductible.
Okay.
So here's a perfect example. So right now, if I receive any type of medical service, I have to pay up front till I meet my deductible. But what will happen is what I'm paying for that service, Blue Cross Blue Shield says, okay, you paid out of pocket $400. We're going to apply that $400 to your $600 deductible. Once you meet that $600 deductible, everything else will then be covered for you at 80% of the plan. You will be responsible for 20%. So now what we're saying is we're going to increase that deductible for plan option A from $600 to $900. So I am paying that amount before 80/20 kicks in. But I'm contributing more to the plan versus the plan is picking, and people under plan option B and high deductible health plan are paying for those additional costs because their current deductible is presently under PPO option B is right now $1,000. So that individual has to receive and pay for all those benefits up to that $1,000. And then high deductible health plan, it's currently $1,500.
Mr. Chair and Felicia, do you think that the what people flex will be increased at all? Because I know a lot of people use their flex to meet their deductible.
So as a member on the PPO option A, you have the opportunity to elect a flexible spending card. And what that helps you to really understand, if you know that you're going to have certain medical services, eyeglasses, you have your co-pays, your prescriptions, you can go ahead and set aside dollars on a pre-tax basis, and it'll be deducted over the 24 pay periods. And it helps you, so I know for myself, I always set aside to make sure that I have the deductible included. So then I know I'm gonna have to pay out of pocket, but the money is already loaded on that card for you. And then I receive a service, I send in the card, it gets deducted slowly through the pay periods. Is it coming out of my paycheck? But it's really no additional cost to me or a burden that I can't be able to meet that deductible. We advocate for our employees that if you are looking at any of these programs, that you should consider participating in that program. Once again, like I said, it's pre-tax, but it helps you to plan for situations. When you're on the high deductible health plan, you have a different type of program. You have the health savings account, and then you also have what we call a limited flexible spending card. Because in that case, that flexible spending card is only limited to use for dental and vision services because you have another account that's set up here that shows that we as an employer are contributing every month $50.02 into this said savings account for you to help be able to pay for those additional services that you receive for your deductible, and it gets applied to that. And if by chance you decide that, I'm saving these dollars, you can also then invest those dollars into other stocks. And then once you decide to retire or you leave the employer, all that money goes with you. It can be sent to another health savings account, or it helps you if you're retiring that you can purchase that mobile home. So, it's your reasons as to what you're going to utilize for that. So that's part of the reason why you look at a high deductible health plan, how it really has changed throughout the years to help individuals to take these dollars of what they've invested to their next employers and participate in another high deductible health plan there.
Thank you.
Any other questions for Felicia? So,
Need a motion, huh?
your recommend option 6?
Yes.
Mr. Chair, I move that we go with option 6 for our health care for 21-22.
I will second that motion.
There's a motion and a second to recommend option 6. Any other discussion? Hearing none, all those in favor say aye.
Aye.
Aye. Any opposed? Motion carries. Thank you, Felicia.
Thank you.
Thank you, Felicia.
Moving on to planning and zoning.
Here we go.
Item number 1, development services. Special use permit case number 20-09.
Thank you, Mr. Chairman. Juan Leal Rubio, Senior Planner with the Planning and Zoning Division. Mr. Chairman, would you like the full presentation? It's on the expedited.
Oh, do we need, do you want, anybody wants to pull up?
Expedited?
No, I don't.
No, it's 1 and 2, huh?
Yes.
So is there a motion to approve?
I'll make a motion that we expedite.
Mr. Chairman, you do have to open the public hearing.
Oh, there is a, okay. Before we do that, I'll go ahead and open up the public hearing and open it up to the public for any comments or is there anybody from the public? Seeing none, move it back to the board for a motion.
I'll make the motion that we expedite 1 and 2.
Is there a second?
I'll second that motion for special use permits cases, case 2009 and special and rezoning case 2021.
There's a motion and a second to expedite permit case number 20-09 and rezoning case number 20-21. Any other comments?
Mr. Chairman, I'm
Yeah.
sorry, was the motion to approve?
To approve.
Yes, to approve.
Yeah. I don't hear any other comments or discussion. All those in favor say aye.
Aye.
Any opposed? Motion carries. Moving on to rezoning. I'm gonna open item number 1 and 3 because they're together.
Bye, guys. Take care.
Thank you, Mr. Chairman. Juan Leal Rubio, Senior Planner with the Planning and Zoning Division. I will be presenting a minor amendment case number 2007. This is a request by Abraham Osman, agent for Guillermo and Antonia Ramirez. The request is to change the land use designation of a parcel 4,247 square feet in size from medium density to business park. The property is located in the business park, the property is located in the Yuma Valley Planning Area at 18860 South Main Street in Gadsden. And this is to accommodate the rezoning of the property to general commercial. As you can recall, a couple of months ago, we did the other parcels that are also part of this project. This is the land use map that you see parcel 57, the one that's being proposed to change today. It will change, if approved, to blue, which is business park. This is looking at the property north. And this is, we received no comments on this proposal, and staff is recommending approval because the amendment is consistent with the Yuma Valley Planning Area, because the amendment will be an overall improvement to the plan, because it will be coordinated and consistent with what's existing out there. And the amendment is in character with the existing land uses and supports policies of the plan to provide consistent land uses. And I'll proceed with the rezoning case. Rezoning case is also a parcel 4,200 square feet. It's in size from low density 6,000 square feet zoning to general commercial C2. And this is to develop a automobile sales lot. This is the vicinity map, parcel 57, crosshatch. Land uses include in zoning LI to the northwest corner, parcel 90. There's an existing home there with a cell tower. And everything around here to the north and to the west is zone R16, mixture of site-built homes and some manufactured homes. And up north, C2, there's, I believe that lot is vacant. And further east, we have parcels R16, also mixture of site-built homes and some ag-related activities, pre-ordinance. And to the south, we have RA40, property in ags, and C2, parcels that were rezoned a few months ago, approved by the board. Picture of the Gadsden area, property in yellow. This is the proposed layout of the project. It'll be a nice improvement to the area. Looking west from Main Street, south from 7th Avenue, looking north from Colorado Street. We received no comments. Staff is recommending approval of this rezoning case with the following performance condition: that within 60 days of board approval,
the owner shall record a RS 121134 waiver and a agricultural disclosure statement. That concludes staff presentation on both cases.
Thank you, Juan. Any questions for staff? Hearing none, I'll go ahead and open up the public hearing. Anybody from the public? Seeing none, I'll bring it back to the board.
I'll make a motion to approve minor amendment 20-7. I'm sorry,
Yeah.
that's 20-22 and 20-23.
Minor amendment.
I'm sorry.
20-7, yeah.
And 2022, yes.
And rezoning 2020.
Yes.
I'll second that motion.
There's a motion to approve minor amendment case 20-07 and rezoning case number 20-22.
23.
I mean 20.
Oh, no, it is 22, sorry.
Yeah, 22.
Yeah,
I looked at it wrong.
I did too.
Sorry.
You got the right ones, huh?
Yeah, we do.
Okay. And
Minor amendment case number 2007 and rezoning case number 2022.
No, that's not what this
No,
shows.
it's not what it says on here.
We're talking about a parcel that's 24,247 square feet.
20.
It is 2023.
yeah,
All right
It is
then, I was right the
2023.
first time.
item
Yeah.
1 and item number 3.
I had 2023 written
I'll go
down.
back to my original for 2022 and 2023.
Okay, I second that
All
amendment.
right.
No,
It's 20-07 and 20-23 are the two
Yes, they are,
that we're approving.
that we're approving.
Correct.
And we are
But you've
moved
got
and
the wrong thing.
seconded.
The last slide, can you show it?
that's
Okay, all right, all right.
okay.
He's
Because
messed-
the other one is back here, way back here.
So
They're
there's-
not
there's-
next to each other. Mhm.
So there's a motion to approve minor amendment case number 20-07 and rezoning case number 20-23.
Yes.
There's a motion and a second. Any other discussion? Hearing none, all those in favor say aye.
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 Any opposed? Motion carries. One. Item number 2, rezoning case number 20-22.
Thank you, Mr. Chairman. Juan Lucasino, panel of the Planning and Zoning Division. This is zoning case number 2022. And this is a request by Kevin Dahl, acting as an agent for the Peterson Family Trust, to rezone a parcel 2.0 acres, gross acres in size from suburban site build 2 acre minimum to suburban ranch 2 acre minimum. And this property is located in the Yuma Mesa planning area at the northeast corner of County 13 and half Street and Avenue 6 3/4 E. This is to allow the installation of a manufactured home. This is a vicinity map that shows the parcel 7 crosshatch. Some of the zoning and uses around surrounding the property include to the north parcels 8, 9, and 10 zone SR2, and parcel 8 contains a manufactured home, parcel 9 is vacant, and parcel 10 contains a manufactured home. Parcel 5 to the northwest is zoned SSB2, currently open desert. Parcels 6 and 7 to the west are currently also zoned SSB2. They contain site-built home, and parcel 6 immediately to the south is also zoned SSB2 and contains a site-built home. Parcel 5 to the east is RA10 and contains a site-built home. This is the view of the property with some of the uses that I mentioned. This is looking north from the road, which is public right-of-way but not county maintained. Looking south from the road. Looking west from the suburb property. Looking east at the suburb property. There's been some improvements to the property. They built some shades for horses, and they did build a perimeter block wall. It looks nice. We did receive, this was late, we received some opposition from 3 neighbors that 2 of them are within the 200-foot radius and 1 of them is outside the radius. So please keep in mind that because of this will trigger the supermajority vote because it's 20% or more, 20% and more of the in opposition by both by area and by number. And staff is recommending approval of this rezoning case with following performance conditions that within 60 days of board approval that they provide an ARS 121134 waiver, that they record an infrastructure disclosure statement and a agriculture disclosure statement. And here I'm showing those red stars show the people that are in opposition. And that concludes staff's presentation.
Mr. Chair, and
Go ahead.
will you, what's number 6 inside there? Is that suburban ranch or is that site built?
Suburban site built 2-acre minimum.
Okay, and the ones to the north on here, this way, up, are suburban ranch. 8, 9, and 10 are suburban ranch?
That is correct.
And they have mobile homes on them?
Parcel 8 and 10. Parcel 9 is vacant.
Okay.
Any comments? Staff or other questions? So you said those oppositions or letters of opposition you got those late last week or this last week?
Mr. Chairman, we did receive, yes, we received emails from parcels 6, 7, and 35, maybe a couple weeks ago, after the commission meeting.
After the. And you said it now because of that it requires a supermajority vote.
Yes.
Now is a question for legal. Is this because we have a board member missing? So what's here counts.
Mr. Chairman, you're going to need 4 votes
Okay.
to approve.
So the chair doesn't count. I mean, if he's not here, so.
He's not here, but he hasn't declared a conflict, so he counts as one of the possible votes. So you need 3/4, so that would be, in this case, 4 out of 5 members of the board.
Oh, okay, 4 out of 5.
I have a question. Is there anybody who opposes this that is here? Oh, you'll wait till the public notice. Never mind.
Any other questions for staff? Thank you, Juan. I'll open it up to the public.
This is your district, isn't it?
See if anybody here from the public wishes to address the board on this item. And you can take off your mask and your name and address.
Thank you. Mr. Vice Chair and Board of Supervisors, my name is Don Peterson, and it's my family trust that has purchased this property for the purpose of acting as the intermediary for my oldest granddaughter, who will be married in November, and she's a horse lover, as is her husband, and fell in love with this piece of property, so I'm helping her out. We'll get the improvements made, and then she can, once it's in place, it'll be easier for an appraisal and financing and pay Grandpa back. So that's what's going on here. Wasn't aware of the protests. We think the zoning certainly fits, and it's our intention, both the granddaughter and my own, to do a very upscale treatment with the property, and it's going to be in a location at the back of the lot that will be really screened off, but again, we'll do the stucco and the things in place to really make it a nice appearing property. So with that, I don't want to overspeak this. Be happy to answer any questions and hopefully obtain your approval.
Any questions for Mr. Dunn? Thank you.
You're welcome. Thank you.
Anybody else from the public? Seeing none, I'll go ahead and move it back to the board.
Mr. Chairman, I'd like to make a motion to approve 20-22.
I'll second it.
There's a motion and a second to approve rezoning case number 20-22. Any other discussion or comments? All those in favor say aye.
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 Any opposed? Motion carries. Thank you. Moving on to item number 4. That'll be Maggie. There she is. Hi, Maggie. Go ahead.
Good morning.
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 Yes, I don't have a PowerPoint presentation for this item.
You know what Tony would say? Good.
What way
Yeah. No.
So, yes, this is a discussion item concerning a possible text amendment to the Yuma County zoning ordinance to address recreational marijuana. And this amendment comes as a result of Prop 207 that became effective November 30th of last year. And it comes following the adoption of the Arizona Medical Marijuana Act in 2010, at which time Yuma County adopted the amendments to the zoning ordinance to allow medical marijuana dispensaries in the C2 and light industrial zoning districts with the approval of a special use permit. Both medical marijuana and recreational marijuana, both are regulated and licensed by the Arizona Department of Health Services. And now, as a result or by operation of Measure Prop 207, Yuma County zoning ordinance allows medical marijuana establishments, recreational marijuana establishments if a parcel is in the C2 or light industrial zoning district and has secured a special use permit to operate a medical marijuana dispensary. So this request is to amend the zoning ordinance to reflect the addition of recreational marijuana establishments under state law. The proposal will clean up the language in the ordinance that currently only addresses medical marijuana. Shift the focus to marijuana establishments, and while continuing to limit marijuana establishments in the C2 and LI districts with the approval of a special use permit. So attached to your information today on Agenda Quick, or to your agenda item, is the staff report that was presented to the Planning and Zoning Commission. It has the proposed changes to the zoning ordinance, which will affect Section 202 of the zoning ordinance. And the intent is to delete the definition of medical marijuana, change the definition of marijuana dispensary, and it'll change it to a marijuana establishment. And the changes in the staff report are in strike and bold format. So anything that is stricken through is text that is proposed to be deleted. Anything in bold font is new text that will be added to the zoning ordinance. Then additional sections that will be affected by the proposed amendment is section 612.03, which is the C2 zoning district, which lists medical marijuana dispensaries, and it will change to marijuana establishments. Same with section 613.03, change medical marijuana dispensaries to marijuana establishments. And then section 116.00, it'll change the purpose statement under section 116.01, which the purpose will now read, to regulate the location and operation of marijuana establishments to conserve and promote the public health, safety, convenience, and general welfare. Additional section that will be affected is section 1116.02. Again, striking anything that refers to medical dispensary to marijuana establishment. Section 1116.03 has additional changes in strike and bold format. And 1116.04, mandatory conditions of approval, same changes, changing medical marijuana dispensary to marijuana establishment. And then 1116.07 with the same changes, striking through references to medical marijuana dispensaries to marijuana establishments. Mr. Chairman, that concludes my presentation.
Any questions for Maggie?
Mr. Chair and Maggie, the only question I have is that the state is going to require that the person who chooses to have an establishment have the special use permit by March 6th. That's not going to happen here in Yuma County. Am I correct?
Mr. Chairman, that is correct. We have not received any applications for a special use permit. Currently, what can happen is an applicant can come in and request a special use permit for a medical marijuana dispensary. If approved, then the state could use that as approval for a marijuana establishment, which would include medical marijuana and recreational marijuana.
But it still takes 30 days or more to get a special use permit through.
Mr. Chairman, it takes approximately 4 months from application to the time that the board takes action on the request.
So we won't have any additional recreational marijuana establishments in Yuma County because it's a lottery with the state, and they have to put $25,000 down, and then they get pulled out of a hat, I guess, or whatever. It's a lottery. So that means that Yuma County is not going to they have to have that special use permit in place before they can apply to be part of the lottery. So that means Yuma County won't, at least this go around, won't have any additional marijuana establishments other than the one that's over on 32nd Street.
Chairman, that is correct. There are no properties in Yuma County that have secured a special use permit for a marijuana dispensary or establishment.
Have you gotten anybody that's been interested in doing that coming into your office?
Mr. Chairman, Supervisor Pancrase, we have had many applicants who have submitted the ADHS form for signature that they will need to submit to the state. However, none of those applicants have applied for a special use permit.
Should we, Mr. Chair and Maggie, should we have started this process a lot sooner so that these people could have been able to get their special use permit? Or, go ahead.
Mr. Chairman, we did start this process as soon as the state approved the measure, Prop 207. However, with the staff having to draft the text and present it to the Planning and Zoning Commission and then to the board, and then send it back to the Planning and Zoning Commission before official action. It's just the process that we have for amending the zoning ordinance.
Thank you.
Just a quick, so Maggie, we're talking just the county, huh? It's or the cities are separate. I mean, if they receive one, it's their deal, not or it has to go through the county too.
Mr. Chairman, the amendments to the zoning ordinance affect only the unincorporated area of Yuma County. The cities have their own regulations.
Mr. Chairman. Maggie, I had a question too. How is this aligned with the city ordinances that are out there? Just, I'm just looking as far as continuity across the county.
Mr. Chairman, I'm not sure how the city handles their zoning districts and their provisions for marijuana establishments. I can look into that before I move it over the, before we refer this item to the Planning and Zoning Commission, or that's information that I can present to the Planning Commission at the time that this item is presented.
Like I said, I'm just curious, you know, you get so many different ordinances and changes and requirements in a county, especially considering there's what, 4 cities within the county or towns, and it gets confusing sometimes.
But, well, just by what I read in the paper is that I know the city of Yuma, they were gonna regulate it or try to very much make it harder, but then they went back and kind of made it, I think, not easier, but, you know, kind of toned down on the regulations, I think.
And see, that's what I've heard too, and I'm just wanting to make sure, you know, we don't confuse anybody that comes in to obtain a permit with us and then look at, say, well, city's doing it this way, Somerton's doing it this way, you know, just for more continuity for the public to understand what's going on or how it's going to work.
Mr. Chairman, I can certainly do that. I can check what all the other incorporated jurisdictions are doing, just to compare to what the county's proposal is and the result.
Mr. Chair and Maggie, are you aware of any other recreational marijuana establishments that are planning or have put in to the cities of Somerton, San Luis, and town of Welton and in Yuma? Do you have any indication that we have any?
Mr. Chairman, no. All of the forms that have been submitted to me for review and signature are within the unincorporated area of Yuma County. I'm not aware of whether the city has received such requests and how many.
Okay, thank you.
And just a quick question, Maggie, on the, I don't recall what number it was, but you mentioned the health and well-being of, I think that one. What do we mean by, if an establishment is close to houses, are we talking, or
Mr. Chairman or Vice Chairman, the current zoning ordinance does, and it's also a provision that's in state law, that a marijuana establishment cannot be any closer for the county, any closer than 500 feet to a residence, a church, a daycare facility.
Is school included in there?
Okay.
Yes.
Yeah. Okay, so we still have that same.
Correct.
Yeah, that's okay.
Yes.
That was okay. Any other questions for me or comments? So, and you're recommending to send it back to the Planning and Zoning Commission?
Correct.
Okay.
I hear a motion.
So moved.
Second.
There's a motion and a second to return the item to the Planning and Zoning Commission to initiate a text amendment to the county zoning ordinance. Any other discussion? All those in favor say aye.
Aye.
Any opposed? Motion carries. Thank you, Maggie.
And then, Mr. Chairman, Maggie will provide that other information about the cities separately in a memo format or email.
Yeah, just send it.
Thank you.
Thank you. Legislative discussions. Oh, let's do a roll call vote. Or, oh, we took a vote. Oh, yeah, I meant you said a roll call. Yeah. I'm sorry.
Yeah.
I thought you were gonna put us on the spot. Who's? No, I'm just kidding. Go ahead, Ian. Hi.
Morning, Vice Chairman Porteous, members of the board, Ian McGahey, Deputy County Administrator. I wanted to give you an update on a few items. Last week was crossover week in the legislative session, meaning that bills are no longer heard in committee in their chamber of origin, and only 4 weeks remain for bills to make it through committee in the opposite chamber. This week marks the first week each chamber will start hearing bills from the opposing chamber in committees. A couple of bills of note: the Military Affairs and Public Affairs Committee adopted a strike everything amendment to HB 2420 that, according to the County Supervisors Association, stems from a disagreement over the Operation Stone Garden grant This bill, as it stands, would allow sheriff and county attorneys to accept funds without board approval, regardless of their purpose. The CSA Legislative Policy Committee voted to oppose this bill, noting that it erodes sound budget policy and transparency statewide, interferes with Board of Supervisor budgeting authority, and could increase costs with higher pension liabilities and equipment maintenance. During our meeting with Yuma County State Legislative representatives on Friday, February 19th, our delegation pronounced that this bill, HB 2447, a bill limiting ADOT to enforce motor vehicle laws to within 5 miles of an Arizona port of entry, was essentially dead, and they were right, as the following Wednesday, the bill died in the House thanks to strong advocacy from Arizona's southern counties. Particularly, CSA noted the advocacy of Yuma County's delegation, so that's some good news. HB 2804 relates to executive sessions, amending the section of the state statute to limit the advice that a public body can receive from its attorneys to 8 specific areas. The LPC voted to oppose this bill, noting that it severely limits the ability of a public body to receive legal advice from their attorney during executive session. HB 2551, a bill allowing for more people to be able to carry guns into public buildings, has moved on to the Senate. This bill would exempt individuals with a concealed carry permit from weapons bans at public facilities, unless the local government provides for guards and metal detectors. CSA has urged a no vote, arguing that this legislation would eliminate decisions made at the local level, forcing counties to either add to or increase current security in order to continue enforcing existing policies regarding guns in their buildings. SB 1406 repeals the license tax and registration fee levied on aircraft registered in Arizona. If passed, SB 1406 would decrease fiscal year 2022 revenues by an estimated $8.3 million based on fiscal year 2020 revenue distributions. These estimated revenue reductions would be split as follows: $4.1 million from the state's general fund, $2.9 million from the state aviation fund, $1.2 million from local governments. As local governments receive 15% of aircraft license tax revenues, with 9.5% directed to counties and 5.5% to cities and towns, this bill will result in an estimated loss of $785,000 to counties and $454,800 to cities and towns, beginning fiscal year 2022. County Supervisors Association Legislative Policy Committee voted to oppose this bill, arguing it would have a harmful impact across the state. And Supervisor Pancrazzi had asked that a letter be drafted that could be signed by this board demonstrating our opposition. That letter is ready. I don't know if there's anything you wish to add, Supervisor Pancrazzi?
This would really negatively impact our little local international airport. The funds that they use to operate. I'm on the Chamber Transportation Committee, and Jen from the airport came and spoke about it and how it would just really impact them negatively if these fees were no longer levied. And so, yes, we do desperately need to oppose this, and it's going to hurt all small rural airports like Buckeyes and, you know, other little communities around the state that have a small airport. So, thank you. Thank you.
Thank you. We do have that letter ready, and so I'll leave it. I'm not sure if it requires a vote or how that works, but there is a letter ready to be signed if you so choose.
Thanks.
Last week, Governor Ducey appointed Alan McGuire and reappointed members Harry Papp and Dean Schweinert to the Public Safety Personnel Retirement System Board of Trustees. As part of the 2017 PSPRS system, the Board of Trustees was expanded to incorporate both employer and employee group representation. Mr. McGuire was one of 3 candidates nominated by the County Supervisors Association for the governor's consideration. He has a lengthy and impressive resume, including having advised every Arizona governor for more than 40 years on economic, fiscal, and policy matters. You'll see the other members of the board on that table there. The other candidates nominated by CSA were former Greenlee County Administrator Kay Gale and former Pinal County Manager Greg Stanley.
Mr. Chair and Ian, I was able to be on the call with the Zoom meeting with the interviews from those folks, and Alan is going to do a very good job for us, so thank you.
The Joint Legislative Budget Committee released its fiscal highlights for the state's January 2021 revenues and expenditures. The state continued to see strong general fund revenue growth in January, with collections totaling almost $1.3 billion and increasing 9.4% above the prior year. Sales tax gains continue to be strong in January, with collections 9.2% higher than the previous year. You'll see in Table 2 there that most categories have seen sizable increases, with the exception of restaurants and bars, which are still hurting due to the effects of the pandemic. And finally, on the federal side of things, the U.S. House of Representatives passed President Biden's $1.9 trillion stimulus package early Saturday. The House voted largely along party lines to advance the stimulus plan, which includes jobless benefits for millions of Americans, as well as $350 billion for state and local governments. With the bill bound for a 50-50 split in the Senate between Democrats and Republicans, lawmakers will begin offering amendments to the House's plan this week. Democrats are hoping to send the bill back to the president's desk by March 14th, when jobless benefits are set to expire. And as I mentioned in my report a couple weeks ago, Yuma County would receive $42 million, could receive $42 million in federal aid from this initiative as it currently stands. And that's my report. I'll be happy to answer any questions you might have.
Any questions for Ian?
Thank you.
Thank you, Ian.
Thank you.
Thank you. Moving on to events, and current events, event calendar and current events. We'll start with you, Lynn.
Thank you. I attended the CSA Board of Directors meeting, the CSA Board, Executive Board of Directors meetings, and the Board of Directors meetings both. I participated in the CSA Learning Series for the new county supervisors as a panelist, and enjoyed that. I attended the Chamber of Commerce Transportation meeting where Jen spoke about that bill. I also attended the YMPO meeting. I was a panelist for Project Central, which is a rural leadership program that, and we did a mock legislative committee hearing with the members having to testify on 4 bills that are currently alive in the legislature, and it was a real good experience for them, and it was really fun for me. I enjoyed it very much. And then I attended the COVID-19 meeting with Representative Tim Dunn, and that's about it.
Thank you, Lynn. Supervisor Lines.
Attended many of the same CSA meetings that Lynn did, and then represented Yuma County for the CSA policy, legislative policy meeting on Friday afternoon. Had the opportunity to spend a few hours in the legislature on behalf of Yuma County the other day. We also had our quarterly Arizona Mexico Commission meeting this week, where we discussed a lot of the COVID issues. It's interesting to note in that meeting that only 800,000 people in Mexico so far have received the vaccination. And those numbers are much lower percentage-wise, specifically in the border regions. And they will be providing some additional data to us. They were looking at receiving some additional vaccines over this next month, but they have not been allocated yet. So we see a below average as opposed to what we're doing here in the United States with people receiving their vaccines. So that does apply some additional pressure here along the border to make sure that we're vigilant and looking out. And I'll have the opportunity again to discuss some of the county's issues tomorrow, meeting with the Senate President and Speaker for an afternoon event where a lot of the legislators will be present. So I'll continue to advocate for some of our goals and priorities.
Thank you.
Thank you. Thanks for that. Mr. Simmons?
I had a meeting with the sheriff reference, AWC's wanting to put a full-time academy out there. Jonathan, I want to thank him for all his work on that because I know he carried the letter directly up to the governor. And again, speaking our case, which is, I think, is great. I also had the CSA Medium County Caucus on groundwater usage, which was very interesting that they were discussing, and the problems coming with that. Also the board meeting, had the county design team meeting, reference our new building, legislative session as well, and also attended the Hank Days Parade out in the foothills, which had a lot of people. They had well over 100 entrants.
Good.
So a lot of people out on the route.
That's good. Then, I attended a YMPO meeting last week. Well, on over the phone, not attended, but and I also I went to visited 2 other counties this weekend, but you know, of the vaccine, one county was giving it to essential workers. That has been giving it to essential workers. So I just kind of I found that out. So I was just kind of wondering, well, is everybody on the same plan, or was it up to each county? So it just, I mean, you know, I had a conversation, and we were talking about the vaccines. Either it goes to the 65 and over or to essential workers, which essential workers are the ones that probably, you know, are back and forth, going in and out or all over the place, and probably taking it back home, which is, it sounds good. I mean, it says, well, you know, it's logic, you know, it makes sense. But also, on the other hand, you know, the most vulnerable are 65 and over. I tend to say that our 65 and over tend to stay more at home, and people that are with them or their siblings, their sons and daughters or nephews and nieces are out there. I mean, their grandsons are out there going, you know, working and seeing other people. So, I mean, I want everybody to get the vaccine. I mean, at least that's how I feel. But it just caught my attention and said, "Well, wait a minute, you know."
Mr. Chairman,
so, yes,
there is one set of rules, but people interpret them differently.
That's the problem. There's no continuity.
So, but anyways, I mean, I don't want to throw them under the bus. It's just, it makes sense either way. I mean, I think it's, you know, you think about it and say, well, you know, it's true. You know, we're the ones out there, you know. I mean, Tony should be staying home. He's 65.
But see,
don't tell him that. He's not.
that's the problem, though, I think, is because other people are not following the guidelines, and then people hear about this, and then they start calling us and getting upset because, well, so-and-so got it here, why can't we? And people need to understand that those people that are doing it that way aren't following the guidelines.
And that's been our challenge here in Yuma County.
Exactly.
When we've had providers operating outside of those guidelines, and then we were restricted in our allocation. We got that allocation back, but now we are the best performer in the state as far as the recording and as far as our disbursement of the vaccine. And I think that's why we'll continue to see our allocations increase along with the SuperPod at the convention center.
And you know, and I'm glad that we're continuing, you know, to do that, and people are beginning to understand that, you know, that hey, if someone got it, it was either there was something, a dose was left, or we don't want to waste it, but just that, and then we're almost, you know, I'm seeing light at the end of the tunnel on this, at least in certain groups, so that's good. So, Susan. Thank you, Susan. Okay, we'll call, no, just kidding.
I guess I need to be faster.
Dang.
I went over by 6 minutes. No, just kidding.
So, I participated with the rest of the board in the meeting with the state legislators on February 19th, another productive conversation. The design and review team met on February 19th. I met over with Supervisor Lyons and the sheriff and AWC representatives to finalize the whole packet to go up to the support for the governor to include $7.5 million in his budget for the Law Enforcement Academy. We had the YCEBT board meeting, as well. I attended the YMPO board meeting and the Arizona Border Counties Coalition meeting, along with Chairman Reyes for that one. All virtual meetings. That
All right.
concludes my report. Thank you.
Thank you. Anything else? Okay. Okay, call meeting adjourned.
All right.